So we use a lot of plant medicines in Lumna. I'm wondering, and I know this is a big passion of yours, I'm wondering what plants can do for nervous system ailments like stress and anxiety that pharmaceuticals can't.
Yeah, really good question. So I'll start with kind of going off of what we just talked about with this stress response and glucocorticoids, cortisol, et cetera. There really are not any pharmaceuticals that I can think of outside of severe extreme endocrinopathies, aka like hormonal issues that are very severe. Outside of that, there's really nothing pharmaceutically to help mitigate the stress response. You can blunt the effects of the stress or anxiety that's already happening, like with a benzodiazepine or something else, where that they're already there, and so you're blunting the effect, but you're not actually changing anything about what I would say the neuroendocrine response, the nervous system and its regulation with the hormonal systems of the body. So that's where adaptogens come in. Adaptogens are herbal medicines, mainly roots, which is very interesting given that earthy grounding aspect of a root. Not all adaptogens are roots, but most aren't. It's kind of a fascinating thing in nature. And they will actually help over time. It's not a quick, easy fix that you take it once and you're just like cured, but it will help to balance that cortisol response. Sometimes people go into a state where their cortisol is very low, and so they really just cannot get up and get going. Other people, their cortisol goes sky high, their blood sugar gets out of balance, they can't sleep, they're running on adrenaline, et cetera. And what adaptogens do is bring you back to the middle. If it's too high, it brings it down. If it's too low, it brings it up. And so that's sort of that neuroendocrine portion. And there's no pharmaceutical replacement for an adaptogen, especially a well-balanced, well-tailored adaptogen that works really well for a person. So that, and I've seen it, I run tons of labs. I have seen it countless times that somebody's cortisol is really high or really low. I put them on an adaptogen for 3 months and bam, first time in their entire life, their cortisol normalizes. And they're like, I've never seen a normal cortisol level. So they work, they definitely work. So there's that aspect. Then of course, there are other herbs and other plant medicines that are still do the same thing. I'm not of the mentality that blunting the effects of something that's toxic is necessarily a bad thing. Like if something helps alleviate anxiety for somebody, natural or otherwise, if it's really distressing for them and they're really, really struggling with it, okay, like there's a time and a place for everything. Ayurveda says everything can be medicine, everything can be poison. It depends on innumerable factors, when it is either of those things. But there is a time and a place for blunting the effects of anxiety and just giving somebody, because then the nervous system has a chance to exhale, relax, release. And in that space, it can, of course, the cortisol will come down and it can be given some time to recuperate, regenerate, and then bounce back, maybe not quite as high as the level was before. So you're slowly adjusting that baseline level of stress and anxiety down. So you have the sort of short-term effects, the immediate effects, and then you have these longer-term, what we call tonification or strengthening of the nervous system, the hormonal system, the fight or flight response, all of that. And all of it really is about the vagus nerve and increasing vagal tone or parasympathetic tone, meaning we're allowing for more rest and digest, more peace, more calm, more relaxation, more rejuvenation. If the vagus nerve is not turned on, there will be none of that. And there will be, again, it goes back to digestion, because the vagus nerve rules your digestion completely, all of your organs. It innervates all your organs. So you can always use that as a good litmus test. If you're digesting well, your parasympathetic tone is probably pretty good, and you're probably getting enough rest and digest. If you're not, if your digestion's all over the place or you're having a hard time, your vagus nerve is off, and we need to adjust that in some way.